Welcome back to Studio 5. For most women, feeling good, looking good rather, and feeling confident go hand in hand. And that's why breast augmentation is one of the most popular cosmetic surgeries. But there are many concerns women have with this operation. Dr. Kirk Moore is a plastic surgeon with Genesis Medical Institute who has developed a revolutionary breast augmentation technique. And Andrea Boyack is a patient who has experienced that new procedure. Thanks so much for being here, both of you.
Thanks for having us.
Dr. Moore, let's start with you. One of the biggest concerns women have with this surgery is pain.
Right.
And downtime. Is this a valid concern?
Absolutely. You know, pain, downtime, and recovery time are the biggest concerns that we have from almost every woman that comes in.
Okay, you have, though, developed this revolutionary new technique for the operation. How is it different from past procedures?
Well, I think that, you know, the biggest thing is kind of like the one, going into it, that you don't expect to have a lot of pain. Two, the technique that I use. And then three, what I have you do afterwards in terms of recovery. You know, the technique that most surgeons, and actually what I used to do is just go in, stick your finger in underneath the space that you need to dissect, kind of bluntly dissect it off, have all the blood vessels rip and tear. You get a little bit of bleeding. The bleeding will then automatically stop on its own. But you get a lot of pooling, you get a lot of inflammation from that blood that's there. What I do is I do everything under sharp dissection, meaning that I find the blood vessels before they bleed, and I control them from bleeding, and I don't get any bleeding in the pocket, don't get any inflammation, and consequently get very little pain afterwards.
So less bleeding, and as a result, less pain.
Yes.
For the patient.
Absolutely.
And a quicker downtime. Andrea, tell us about what was your experience with the pain and the downtime?
Well, I actually had my surgery done on a Thursday. The first thing I did Friday morning was go shopping for new clothes. And I was back to work on Monday. So
a matter of days.
Yeah, a matter of days, really. And I probably could have gone back on Friday, but I chose to go shopping.
Good choice.
Take another day off, right?
Yes, enjoy it, absolutely. And did you go into it expecting a fair amount of pain and discomfort?
Well, yeah, because, I mean, the majority of my friends, they had a great result to speak of, but they had terrible stories of their recovery. So I was surprised to find a doctor who says that it was as minimal of a recovery as it actually was.
It can be that painless. Is her experience typical?
Very typical.
Yeah.
You know, it's just, it's amazing. People come into it thinking that, no way, it can't be done, I'm not, you know, and they're very skeptical about it. I see everybody, you know, all of my patients the next day, and they all kind of walk in smiling. A lot of them have driven their own car there to work. And, you know, they leave. They went out to dinner the night before, you know, so the night of their surgery, went to a movie, all kinds of things. So it's very, very quick, very rapid. You know, I can't promise that everybody's going to be the same, because you know, one person's pain is another person's pleasure. But, you know, it's just, but the vast majority of 90% or better kind of fall within those parameters.
Well, and to know there can be the potential of less pain involved might be just the reassurance the patients need to take that step.
There's a lot more moving, a lot more stretching. I don't bind you down. I have you taking a shower 2 hours after your surgery. I have you washing your hair, blow drying your hair, because I want that movement. I want those arms to move.
To start to work.
You know,
and
you're laying on your stomach,
the
directly on your stomach the next morning, so directly on your chest. Again, the idea here is to stretch the muscle a little bit to kind of keep it from going into spasm, which I think is what causes a lot of the pain.
All right, Dr. Moore, thank you. Thank you so much for sharing your story as well. For more information, you can find Genesis on the web at genesisinstitute.com. We'll link you there from our website. We've even posted some information how you can get a consultation that normally would cost $250 for only $50. So all of that information available on the website.